Now recording. All right, so today our session is on Tamanu, which is a patient-level electronic medical record system that can be deployed for disease surveillance, lab requests, and patient care plans. And it is in use for HIV and COVID-19 in some of the Pacific Island nations, including Samoa and Fiji. And our facilitator is Dr. Michael Noonan. He's a director of Beyond Essential Systems, which designed Tamanu. And he will introduce the software and give context for the country presentations. So please be aware that you may need to adjust your speakers a bit as we move between live and recorded presentations. And you're welcome to ask any questions using the Zoom chat window. We will have time for discussion after the presentations, and we do ask that you mute your microphone unless you're asking a question. I'll apologize in advance for any background noise on my side. For various reasons, I won't be able to mute my mic the whole time. If you hear a dog, it is mine. Okay, and then we'll plan to wrap up a few minutes before the hour, as we understand people have other meetings to attend after this or other things to do in the evening. So we'll make the slides and recordings available after the session as well. What we have now is posted. So if you've got that link, you'll be able to access that. And with that, I'll turn it over to you, Michael.
Thanks so much, Dana, and thanks to everyone for joining today. It's a great chance for us to meet a slightly different audience to who we usually get to meet, and yeah, really grateful for the opportunity. I also want to start with a bit of an apology. It's a bit of an unusual presentation today because we'll have presentations from two country partners, but they won't be with us live. It is 10 p.m. here in Australia, where our main office is based. For the two country partners that are presenting in Samoa and Fiji, it is midnight and 1 a.m. or the other way around, 1 a.m. and midnight respectively. So we decided not to put them through that, and are using recordings taken last Wednesday and Thursday from them. But that's hopefully okay. A little bit unusual, as I say, but I'm on the call. I've also got my colleagues, Megan Lane, and I see Tessa Hughes has joined. Megan is our program manager for Tamanu, and Tessa is a project manager with us as well. I am going to do a very brief introduction, hopefully not death by PowerPoint, but I know that none of you will have heard of Tamanu, so I'm going to give you a really, really quick helicopter view of it and a 5-minute demonstration of what the presentations are talking about today. In the two presentations that you'll see, which are both very brief, they don't actually demonstrate the software. So I'm going to give you the very, very quickest software demonstration you've ever seen, just so you've got a little bit of context to what they're talking about. As you might know about most Australians, we don't stand on formality very much. So please feel free to interrupt me at any time if I've said anything completely crazy. There is, of course, time for discussion at the end after the two presentations, but I never mind being interrupted, either just jumping in or writing a comment in the chat channel. It's always my preference rather than me just rabbiting on. So let me share my screen and hopefully share the correct one and go from there. I'm going to also assume that someone will holler out if they can't see my screen. Oh, terrific. Awesome.
And we can hear you, of course.
That's good. Actually, I have had some trouble with this particular Bluetooth headphone today. So if it starts cutting out, I've got a backup, but let me know. So we're an Australian company where we are focused on development of e-health predominantly, a little bit of education software in low and middle income settings in Asia Pacific. And we really focus on the Pacific. We've got 40 full-time staff across offices in Melbourne and Auckland, as well as project offices in Fiji, Tonga, and Samoa, and soon, as of early next year, up in Palau as well. And our software suite includes Tupaia and Tamanu. That's our software that we develop. We also implement mSupply, DHIS2, and we work with Senite, which is an open source LIMS. All the software that we develop, so Tupaia and Tamanu, and the software that we prefer to work with, is completely free and open source in low and middle income countries. And Beyond Essential has what we call a profitable sustainability model, where I know every company says this, but we really try to live it, where the purpose of what we do is the outcomes of the work. we drive our profits back into project implementation and software development. And we're actually recently very proud to get accredited as a B Corp. So the question is, why Tamanu? Why develop a new EMR when there are probably hundreds on the market, at the very least dozens of capable EMRs on the market? And back in 2017, we actually just set out to see if we could be a vendor for one of those softwares in the Pacific, where there were effectively no EMRs, certainly no scalable EMRs being used across the Pacific. And when we refer to the Pacific, I should say we refer to the 14 major Pacific Island countries and territories in the Southwest Pacific. Those are countries, some of which you've probably heard of, like Fiji, Vanuatu, Samoa, and Tonga. Others you'll probably be slightly less familiar with, like Tokelau, Tuvalu, Niue, Kiribati. It's a specific grouping of countries. It's not every country that surrounds the Pacific. So Tamanu, so what we set out to look for in an EMR were these 5 principles. So it had to be sync enabled out of the box. It had to work seamlessly offline whenever the internet was down. And that had to be true across desktop and mobile. So web-based systems just simply don't work in the Pacific. And it couldn't be something that needed a lot of configuration to get it to run on sync. It had to be sync first. Secondly, free and open source, because we very, very strongly feel that countries shouldn't be locked into a single vendor, that there should be other implementers for software that gets developed, and that we should be contributing to a public good. It needed to be desktop and mobile enabled out of the box, not that you would be integrating different third-party softwares, because the IT capacity in the Pacific just doesn't allow that to be sustainable without really, really intensive ongoing IT support from external third parties. So we wanted a software that was desktop and mobile enabled. And as I say, going back to principle 1, that was sync enabled across both those platforms. Data, of course, fully encrypted at rest and in transit, and of course interoperability with both existing standards like CPT or ICD-10, as well as the ability to integrate easily with other softwares used in the Pacific. So DHIS2 and MSupply being the most obvious examples. And certainly back in 2017, we couldn't find a software that met all 5 of those principles. And so we set out to make Tamanu, really with the Pacific in mind, the most remote settings in the world. So we have been working on Tamanu. It's been in active development for the last 3, nearly 4 years now. And these are the current modules that we have. So it's a fully featured EMR across desktop and mobile. So it's a birth to death record. The idea being that you handle all encounters with the health system within the one ecosystem. So that can include NCD screening. It can include disease screening, communicable disease screening, I should say. It can include inpatient management, care plans. It can include acute care. So there's an emergency department module, a triage module, and all those sorts of things. It also has a program surveys module, which allows you to very, very rapidly build program surveys and import them into each implementation of Tamanu, so that you can very, very easily attach vertical program data to a patient without having to use other data collection apps, which can be quite clunky. So these are our current implementations or planned implementations. So we're currently implementing in Fiji, Samoa, Nauru. We're about to start implementing in Palau. Excuse me. And we have a multi-country implementation with an NGO in Australia called Motivation Australia, who provide disability services and equipment in a number of countries. And Tamanu was also recently accepted for inclusion in the Digital Square Global Goods Guidebook, which was something that we were working towards for a couple of years. It's the only Pacific-based and conceived software in the guidebook, which we're quite proud of, and we feel is quite important to our partners in the Pacific. Not that this is something that can only be used in the Pacific. We just wanted something that they could feel proud of and feel ownership of. We also have the first level of ONC certification. This is what our overall ecosystem looks like, and I'm not going to dwell too much on this because it's a fairly short presentation today. It's a fairly short time frame today, and we want to get to these presentations from the country partners. But what we implement in the Pacific Island countries that we work in is this ecosystem. Now, we're not implementing all of these systems in all of the countries that we work in, but somewhere like Samoa, we absolutely are. So we implement Tamanu as the patient level electronic medical record, DHIS2 as your data warehouse, MSupply, which is a logistics management information system. Some of you, possibly lots of you, will be familiar with. We partner very, very closely with the MSupply Foundation. And Tupaia, which we use as a reporting layer, a visualization layer that sits over the top of that. And that's a mapping-led visualization layer. We're also able to feed in cross-sectional data via our own data collection app, Tupaia MediTrack. Won't be talking about MediTrack today, but that's really to look at things like clinics, infrastructure, disaster response, anything that requires cross-sectional data collection that is not related to an individual patient. And what you get is this single ecosystem where everything operates, nice and smoothly and in a completely integrated fashion. This is what Tamanu looks like from the text perspective. So we have a central server, what we call the sync server in this diagram, that sits in the middle of an implementation. So the country will have a single central server, which can be locally deployed or it can be cloud-based. And then each inpatient facility or large facility that requires desktop will have a LAN server based at the facility. And there is two-way sync between the central server and the LAN server. Now, we can put the LAN server onto an individual computer so that it can all be bundled, for example, on a laptop that you take out into the field. And you can also have what we call Tamanu Web, where an individual computer connects directly into what we call a deployed LAN server, so that LAN server doesn't need to be a physical on-site server at a hospital. If you're doing, for example, a mobile clinic, you can take a laptop into the field, and so long as you have an internet connection, you could use Tamanu Web. But generally speaking, we would deploy a physical LAN server to each of the facilities or the laboratories that we're working in, and that LAN server can operate entirely independently of the rest of the system. The internet can drop for hours, for days even at a time, and the system will continue to work seamlessly for the users before it syncs data in two directions when it comes back online. And we see that working all the time in the Pacific. The internet is unbelievably flaky, even in central government buildings. Tamanu Mobile, everything is bundled onto the app, obviously. So there's two-way sync directly between mobile and that central server. I don't know if there's any sort of tech people on the call, so I'll just run through this in 20 seconds. That mobile has SQLite, that's a database, and a React Native front end, obviously all sort of bundled together. Desktop runs React Native on the front end, it's bundled into an Electron app, and both the LAN and the sync servers are running Postgres with Node. As I say, I don't know if anyone cares about that, but chuck that slide in there in case people want to come back to it. So I'm going to do a brief demonstration before we get to these presentations, but today's presentations are by Lenara Tupaifui from the Samoa Ministry of Health. She's the acting CEO of Health Information, Technology and Communications, and she'll be presenting on their national COVID-19 vaccine program. And then Simon Kumar, who's from the Fiji Ministry of Health and Medical Services. He's the manager of all IT services at the ministry, and he'll be presenting on their national COVID-19 laboratory test program. Now, usually I have some slides in case my live demonstration goes completely haywire, but let's see how we go with a very, very brief live demonstration of just a single workflow in the system, just to give you a bit of a sense of how it works. And I've got my eye on the clock so that we don't run out of time for discussion or anything like that. So this is Tamanu Mobile. I won't go through logging in. I won't go through searching for patients. But the way that it works is that it syncs across patient details, first name, last name, sex, date of birth, unique ID, and home village of all patients in the system to each mobile device. And we can handle a ton of data with that, up to probably 1 million patients on each device, because it's not a lot of data. And that initial sync takes only about 10 minutes. After that, syncs take only a few seconds. I won't get into the details of the sync. Let me just run through the workflow. So what they're doing in Fiji at the moment is all of their national COVID-19 test program is run through Tamanu. So there are swabbing teams out in the field who are going around to people doing COVID-19 swabs and sending those swabs to any one of 6 laboratories in the country. When they take the swab, they don't know what lab it's going to end up at. So the labs need to be able to call up the lab request regardless of where it was collected. I am going to show you so quickly how that works for my name. So we will say that we are doing a screening test. For me, the specimen is attached. We'll say the time and the date and the lab request type. Now we can do a COVID-19 swab. Okay, so you can do a nasopharyngeal swab and submit that. And it's as simple as that. Just going to write down that code, and it has generated that unique lab request ID, which the laboratory is going to be able to use to pull up that lab request and enter a result against it. You can also, though, be super flexible about the tests that you can request out in the field. So, for example, if you have a field going around collecting samples for HIV screening, you can do this and test for HIV and send that test off to a central lab somewhere. And again, they can use that unique ID that's been created. And I'll just write that one down as well. Right, to call up the result, to call up the lab request and enter a result against it. What you can then do is attach additional information to that. So that is simply the lab request with the very basic details of the sample that was taken. But you can then add additional information. So for example, if you want to do an HIV risk screening form while you do the lab request, you can do that very quickly. So this is just a very quick survey that we've thrown together. This is not being used live in the field at the moment, but based on a few resources that I think we got through CDC. Have you been tested before? Negative. Have you ever shared needles? Yes or no. Have you experienced any symptoms? Let's just say yes and yes for this patient. It then asks the nurse or the screening officer, have you conducted a rapid HIV test for this patient? And you can select yes, I conducted a test today, but the result was invalid. Okay, so you can submit that. Okay, the other thing, of course, is that you can do a COVID-19 sample collection form. So we're kind of doing 2 samples in the one go here. I just ignore that. It's looking for a subdivision there that doesn't exist on this development environment. I promise you that works completely fine in Fiji. Obviously, the environment that I'm demonstrating to you today is a development environment, so all the data is test data, and it's occasionally missing reference data that it would usually populate with in the field. Now, I'm not going to go through and answer all these boring COVID screening questions, but if, again, you can do rapid diagnostic tests and result them. We're going to just go through next page and submit that. Okay, and the last thing to do, it will automatically sync every 10 minutes when you're using the device, but I'm just going to force a manual sync so that we don't have to sit around waiting for that. Also within mobile, you can record encounters, outpatient encounters, so you can record diagnoses and treatments that have been given. You can do checkups and record vitals. You can refer patients to any facility in the system, as well as different types of referrals. You can record vaccines, and you can do campaign vaccines, as is happening in Samoa at the moment. Just do any batch number, injection site. Again, I won't go into this, but there is some decision support built into this if you try and give vaccines at the wrong time, or if you've given one campaign vaccine. Well, it's a bit weird. It's getting its time confused. It would in the field, pop up that is not allowed to be given until 8 weeks post the first one. So that's mobile in the quickest demonstration I've ever done, and I'll jump quickly across to desktop now and show you those coming in. So this is the desktop version, and this is a far more comprehensive inpatient capable system, so that you can have you can triage patients through an emergency department. There's an emergency department waiting list. Don't know if there's anyone in there. Oh, there's a couple of people in there that automatically generates a waiting list based on your triage. But what I want to show you is lab requests. So lab requests come in from all across the country. Now, if you know the patient's name, you can type it in and see the lab requests that have been created for them. You can also type in the lab request ID that was created before, so that you can pull up a specific lab that you want to enter a result for. So for this COVID-19 swab, I can come in here. I can set the laboratory that it's arrived at. So Nandi Hospital. I can change the status to results pending. I'm just going to do everything in one step. I can enter a result against it. It's positive, whatever the test method was. Laboratory officer, verification, if you've got verification data, and confirm it. And for that one, I would then publish that result. And in Fiji, you can actually, patients are able to look up an online widget where they type in the lab request ID that has been given to them by the swabbing teams, and their result can be searched automatically. So it's been taking enormous pressure off their the main support centre for COVID in the country, which was basically running a hotline for people to call and receiving hundreds and hundreds of calls a day. Most of those patients can now go online and find their results online automatically. Coming back to the lab requests, the other lab, of course, that we wanted to do was the HIV test. And there's different types of tests you can do. So there's numeric tests. You can select from drop downs. There's binary results and all that sort of thing. For this patient, we are going to say that they are, say, positive. Actually, no expert in HIV laboratory tests, so I'm just going to take a guess there. You can then go back and look at that patient encounter and begin to manage them immediately. So you can record a diagnosis, confirm. You can start a care plan with them. We won't go into that, but you can start running a care plan. You can enter other lab results, procedures, notes, imaging. You can prescribe medications and start to manage that patient there. The other thing, of course, you can do is if you need to do contact tracing, the surveys that we just filled in before for HIV risk screening and the COVID-19 sample collection form are there. And all the details, which would usually be filled in, are then available for you to immediately start contact tracing, all in the one environment, which is quite cool. Okay, that's probably enough demonstration, and hopefully gives you enough context to understand the presentations, which are very brief, but hopefully make a little bit more sense with that context. So I think Dana is going to go. I'm just going to see if there's any questions from Steve. Yeah, that's the correct website, Steve. So Tamanu.io. We're just about to launch a new website, actually. Oh, I see Megan's been answering the questions. So I will stop talking, and yeah, Dana, if you want to run the videos, that would be great.
All right, here we go. Can everyone see the video screen?
Yeah, looks good.
Great. Okay, here you go.
When we started our COVID vaccination process, we foresaw a lot of challenges, and we also experienced a few challenges. For example, we weren't receiving all the vaccines at once, so we were getting them in portions. And when we did get the portions, the expiry dates was really close, so we were given about 2 months to have to use up those vaccinations and administer them before they expire. And one of the major challenges with Samoa not having a really reliable health information system to manage patient details was the lack of unique identification to identify them. So we currently had an information system that had a record of 800,000 population reported. There was a huge number of duplicates. So it was not reliable information to use, especially when we were not given, when we did not have all the amounts of vaccines we needed in order to vaccinate the whole population. It was just the end of 2020, around November, where we also have a national ID project that's managed by the Samoa Bureau of Statistics. And we were very fortunate that they collected this information for the national ID purposes, right when we were also discussing getting the vaccine for COVID vaccinations of Samoa. At that time, we were not sure the eligible population of an exact total population of Samoans in the country. And also we were not sure of how many people we actually have in the country that were eligible to be vaccinated. The data that was given by by the Samoa Bureau of Statistics was really helpful in helping us identify. Also during this time, Samoa had already activated its state of emergency processes and procedures. So there was very minimal traveling and immigration happening for people to travel out and travel into Samoa. We were having about 1 repatriation flight a month. So if the numbers changed, there was very minimal change in the population numbers. From that data, it was Samoa Bureau of Statistics collected 215,000 of the total population. And out of that number, about 121,900 were eligible, and the eligibility was counting those 18 years and above. The challenge was how to manage all that information in order for us to pick up our eligibility criteria and eligible persons. With that, we turn to Tamanu. Was there enough time to actually implement Tamanu in such a short period of time to ensure that we were able to manage the details? There was a little bit of doubt, but after a lot of discussions, we found that the mobile version was very user-friendly, very easy to implement, and it took us less than 2 months to get that on the go. With COVID, we were also very not so sure in the beginning, given the technical advisors for the system will not be able to travel in country. But then again, every challenge there's always an opportunity to grow. So we took on the challenge, and we did after a lot of online consultations and the Beyond Essential team working up into the late hours of the evening and early hours of the morning, meeting online and helping us with the system. We were able to have Tamanu Desktop and Tamanu Mobile up and running, and we were able to import the whole 215,000 population data into the Tamanu system. From that system, we were able to segregate how many of the population were in one island and how many were on the main island, which amounted to 24,000% or 24% in the big islands and 76 in the main island. This helped us a lot in planning how we were going to roll out our vaccination process. With the data now having villages on it, we were also able to depict these and indicate these on the Samoan map. We were also, our first strategy was to focus on the densely populated areas, which is also around the main town, main Apia area. And the other reason why we strategized to go with this was because this is where our main ports were, the main airport and the main seaport. So if COVID was to ever get into the country, it would be through one of these main ports. Hence, using Tupaia and visualizing it on Tupaia, we're able to pick out where of the country the eligible populations were getting vaccinated. And it was very hopeful when Tupaia indicated that a lot of those living in the densely populated area were actually coming in to get vaccinated. And that was indicated by the orange-ish colors. Samoans are also very competitive. So the neighboring villages that saw their areas were still red did not wait for the vaccination rollout to come to them. So if you'll see on the bottom, some of the areas were already showing yellow or green before the vaccination rollout actually came to them. This was a very positive sign. As we were implementing and using these district level mappings, you will see that some of the districts were starting to get very high level of vaccination coverage. These mappings helped us and helped the teams reallocate our resources to where it is most needed. So once the area started turning orange or yellowish to green, then the neighboring district health facilities will reallocate their human resource as well as their vehicles or their staff to go to areas that were really red, which indicated very low vaccination, and then start vaccinating from there. Usually with intervention programs in the past years, we would all wait until a certain process was completed before you can compare the data and really decide on what strategy you're going to do to intervene and boost the process. But with the Tupaia mappings, this helped us within a few hours to decide on what the strategy will be the next day. So it was helpful and stressful at the same time, because sometimes viewing maps at night and then you'll get an email in the morning of what needs to be done. But then again, it really assisted hugely in boosting our vaccination rollout and our vaccination process. So at the end of every night, everyone is waiting online for the maps to be sent out. And I think with maybe Ashlyn has grown a few gray hairs, us pushing every night that we need the maps updated. The Tamanu system was also really helpful, because sometimes when it indicated to us when some villages have been red for so long, then maybe it's not because people are not coming in to get vaccinated. So we went around we printed certain lists from Tamanu and headed out to the community. And there we found that some of the people on the list were not in country. They left for seasonal work. Some of them have already passed away. Some of them are included in our exemption criteria, pregnant or 8 weeks and less, or a minimal amount refused, maybe just 0.something%. And some have actually gotten married or moved to a different village. But we did not pick up on those, as we have only been focusing on getting people to come in and get vaccinated. So that was the other level of reporting that Tamanu helped us with, identifying those people and then mark them on the system so they don't show up as a negative vaccination population on the mappings. Because no matter how many times you go back to get to vaccinate an RSE worker, you will never get them, as they are never in the country. this function was already inbuilt into the system, which was really great because you can now do both vaccinate a person and also not vaccinate them, but identify the reasons behind why they were not vaccinated. So they are not depicted negatively by the community when they are picked up. With our data process, as Ashlyn has also presented on, we pride ourselves in that we were able to really train our nurses, our non-technical staff have been the real champions in having this system being implemented. One of the things we really pushed is for the users of the system, especially the clinical staff, to be champions in the system. The IT people will just be there to facilitate and ensure that they are not frustrated with the system, but they have been the real champions in assisting us and helping us do the data entry, search for their own patients, and at the same time do their clinical duties, carry out their clinical duties. One of the things that Tamanu really helped us with was filtering each person on Tamanu using the existing data by households. So we were able through the months to know how many of the households in Samoa were fully vaccinated, how many were partially, and how many still had not had an eligible member vaccinated. With only 30,700 households in Samoa, this was a really helpful data in allowing us to know, because around August, we did a door-to-door vaccination process. And whether it was working or not, this data really helped us. And the first of August, when we just started, we had about 5,000 fully vaccinated households. Towards the end of last week, we reached about 11,000 fully vaccinated households. So that is one of the powerful information that Tamanu helped us pull out, and also really helped with our intervention programs. The system has also been very helpful. And I think one of the other things that had ensured success of the system was collaboration with other government ministries and organizations. If we hadn't done, the data we got from the Samoa Bureau of Statistics really was like a pre-registration of our total population. It would have been data that would take us more than a year to collect in order to finalize our eligible population and do a lot of calculations in order to get where we are today. But that collaboration really gave us the data that we needed to push our communities and all our non-clinical staff and clinical staff to really appreciate the system that was there. Also promoting awareness of our systems and building acceptance and confidence. Tamanu is a really user-friendly system. So, and one of the things we try to avoid is introducing a system that people will feel frustrated with using. But if you see from the photos, the staff have been really looking forward to mornings when we do vaccinations. The nurses are always the first ones to come and get their tablets, and always they want to vaccinate and enter the data at the same time, which is a very positive indication going forward, especially in health information systems, because then it makes our work easier in introducing the systems for them, and especially when they already start.
Well, Dana, I think that's taking us back to the start.
All right, I will go ahead and queue up our next video. And Michael, if you want to introduce that.
Sure. So yeah, the next video is Simon Kumar from the Fiji Ministry of Health. It's even briefer. It's only I think it's a 10 or 11-minute video, but he just talks a little bit about some of the challenges around the deployment and I think a little bit more of the specifics around the tech. Although It's not too down in the weeds.
Hold on. Sorry, I've got a couple too many screens open at the moment. All right, here we go. Wait.
We have implemented Tamanu in Fiji. Tamanu is the first product that we have in Fiji. During this pandemic, the COVID-19 cases increased on a daily basis. This second wave started from April this year, and there was lots of cases.
Gina, is there any way to increase the volume on this? It's difficult to hear.
Thousands and thousands of cases that occur on a weekly basis. Many people were swabbed, but they couldn't actually get their results on time. So basically what happens is if a person gets swabbed, he or she was told to stay home for 14 days. And then once the result is cleared, then that person actually returns to the work. So there was so many testing that has happened on each day that people actually can't get the results on time. There was no central data repository. It was time-consuming effort for data cleaning and merging of records. So before we have adopted this Tamanu, divisions, they were using the Excel sheets. So there was 3 or 4 different types of Excel sheet that was sent to the divisions, where the officers on the ground, they collect the data and then they enter into the Excel sheet. Once the Excel sheet was all filled for a day, then it was sent to the Emergency Operations Center, and then the officers actually do the data cleaning and then merging all these records. So that was the process that was actually carried out in that time before we implemented Tamanu. And it was time consuming, and sometimes there was kind of like duplicate records actually happen. So passengers to actually work after hours to clean the data. And there was no public access to their results. So person has to wait for their results, actually expecting the call from the Fiji CDC, and once they receive the clearance letter, then the person can actually resumes their work. So this was one of the issues that we have encountered. During this pandemic, there was no time for us to actually find the other solution where we have to start from the scratch. We are currently working with the other projects, like Megan has mentioned, that primary screening and M supply. So we thought of having this Tamanu system in Fiji for the swabbing, where there will be a less customization required in a less time. So that was the reason we thought of getting Tamanu. There was business processes that was involving. So there was 3 that I noted, I listed here. Swab, lab, and the results. So swab is basically the lab request is created at the regional sites using Tamanu Mobile. Tamanu generates the unique lab request ID. Lab request ID is then written on the sample and given to the patient on a card. Once this swab is done, then the swab actually arrives at the labs, and then here we have all the labs can see the lab request. Test is undertaken, and lab staffs enter results against the lab request ID. Once this samples is published, checked, and then offices, they actually publish these results. For the negative, it's published straight away. For the positive results, it requires some consultations, the internal business processes that needs to be followed before it's been published. So the results are instant. In 10 minutes, it's been published, and it's available on the Tupaia platform. And then the patients can search for their results using online widget or by contacting a call center, which is a emergency operations center that's situated or located in all the divisions, 4 divisions. In terms of the statistics, as you can see on your left, we have the number of sites or subdivisions that is currently using Tamanu. Suba, it records the highest number of lab samples or the lab requests. Then it goes to the Western Division, and then followed by the Northern Division. Looking at this data, we have seen these changes in terms of the results that has been published on time, and users are happy in terms of how the data is exchanged. And these results, the main thing is that the results are available online. It's a confidential information of a person, but the way it's been presented on the web, it's only the person who are swabbed will be able to know his or her result. No one will be able to know the results because it's the way it's been displayed is kind of a confidential information. Some enhancements in Tamanu that recently done a few weeks ago can now record in RDT, that's a rapid diagnostic test, on this spot without sending a lab request. New questions added to survey. We have seen the improvement in reporting where the line visiting and also the disease, the swab results by divisions, and also we have seen the number of people positive and negative. So there's a list of statistics which are actually covered in reporting. Improvement to the workflow around viewing previously created lab request. We have audit trials for status change. When this when the labs receives this swab test, actually they need to change the status. So there's an audit trial which is currently added in, which allows the users to actually track the every changes. Can now capture verification data, multiple lab requests, notes, and all test methods. So this is my lab results. You enter the lab request ID in that search text box, and once you click the search text box, you will be able to see these results. Negative is straight away, it's been published. The positive one, there's another set of processes that needs to be followed internally before it's get published. And if you haven't received a result, so there is a report will actually state that the results is not yet out. And if you look at these results, person cannot actually determine whose results. It's only the person who knows that this is his or her results by typing the lab request ID number. I just like to say that it was really helpful from the team, the technical team who actually helped us in setting up these lens servers, who have actually assisted us in setting up of this Tamanu system. It was a difficult time for for us here in Fiji, where we were actually involved in most of the activities. For example, providing the supplies to the needy facilities. People were actually in home isolated, and it was a difficult time. But during this pandemic, this system has actually helped us to track the swab results for people, and also it assisted that companies, companies, they really wanted to know whether their staff has been actually infected with virus, so that they can start isolating the other staff. So this clearance letter, this lab results, all it was really helpful for the MOH team in terms of getting this Tamanu system up and running. In terms of functionality, it's very simple. It's easy to understand, and unlike the other system where you have to actually go through a lots of exercise to learn, for Tamanu, the swab system, we didn't have to go through lots of training and all that. There was a training only for those who are not used to computers, but other than that, most of the 80% of the staffs, or probably more than that, they were able to actually go through this Tamanu app and able to actually enter the swab records. Why we have implemented
Oops.
Tamanu in Fiji? Tamanu is the first project that
Thanks very much. To answer a couple of the late questions in the chat channel, there was one from Jamal. So this is about the lab requests IDs that are being generated on mobile. So just so everyone's clear what we're talking about, let me just very quickly share my screen so you can see. So a couple of people have been asking about these lab request IDs. Now, it's important, of course, to distinguish between the lab request ID and the patient ID. The patient ID is unique, and that is generated centrally. So, well, actually, you can generate a patient ID locally. You can create a new patient using Tamanu Mobile. If I come out here, you can click register a new patient. And enter the basic details for them, and that will actually generate a unique ID. The IDs that are generated for patients, though, are almost guaranteed to be unique, because the out-of-the-box template, which is 4 characters and 6 numbers, pretty much guarantees uniqueness. Now, that's an out-of-the-box version. Countries can choose their own system for generating IDs, and in fact, Fiji uses a different system to that. And some countries, Samoa, for example, don't allow patients to be generated remotely. They have to be generated centrally and synced down. So countries get to choose. But the lab request IDs get created in the field, and obviously, it's creating these IDs. Not obviously, I shouldn't say that. It's creating these lab IDs locally. So if I click on a new request, it's just generated that 7-character lab request number automatically. Now, that is not 100% guaranteed to be unique, but it is extremely rare to get duplicates. I think in Fiji, we're expecting about 1 duplicate a year or 2 duplicates a year from memory, but the system handles them quite elegantly. So if the laboratories type in a lab request number that has a duplicate, it will simply call up both. You'll be able to see the dates of the lab request, you'll be able to see the patient details, and it should be quite easy to cross-reference those. based on the additional information that you have. The chances of them being for the same patient on the same day are obviously zero, or as close to zero that it doesn't matter. If a patient types a lab request ID into the online widget, it will, I believe, it returns a message that they have to contact the Ministry of Health. But you're talking tens of thousands, potentially hundreds of thousands of lab requests before that happens, and that patient would then have to contact the Ministry of Health and be given their result manually, which is really not the end of the world. We can also set it up that it returns 2 results to them. And I think Fiji requested that they have to contact manually, but you're talking something that's going to happen only incredibly rarely, and it doesn't really affect the system. We feel it's handled quite elegantly. So going to the last question, I should probably answer in order. So how do we get data out of the Tamanu database? So generally speaking, and I should say I'm not the best tech person to asking. Our tech people are all, or our devs are all very much in bed, but we have an API that allows us to push data out to Tupaia, to DHIS2, and to MSupply. I've not heard the term. Well, we don't refer to it as a connector module, but what we use on Tupaia, for example, is what's called an integration engine. That's not right. What do we call our integration engine? We used to call it our integration engine, and that has an API. What we're trying to do in our latest designs with MSupply and DHIS2 is follow FHIR, so HL7 FHIR as our standard. So where it's possible to use FHIR, we're trying to do that in the future. In terms of connecting to BI tools for visualization and reporting, our out-of-the-box one that we connect with already is Tupaia. So Tupaia is our own software. Tupaia is a business intelligence tool. We don't currently connect Tamanu with anything else. We're fairly agnostic about interoperability with other BI systems. We just haven't been asked to connect with any of them yet, and you know, our preference obviously would be Tupaia because they've kind of been designed very, very closely with each other. So if you saw within Linara's presentation, as they are giving vaccines in the field, that data is automatically being reported through Tupaia and in real time. I can show you even what that looks like for those who haven't seen. This is Tupaia. Sorry, I'm conscious that we're hitting up against time. So Tupaia is an end-to-end data platform that's focused on mapping-led visualizations, and we support a ton of projects, mainly, as I say, mainly in the Pacific, both at the country level and at the regional level. Tupaia is probably worth a whole another hour to talk on it, but yeah, it's pulling data out of Tamanu. It comes into Tupaia and then populates these visualizations that we create. So I guess to all of those, we're very happy to provide more detail later. I've actually got a meeting tomorrow morning about our latest integration up in Nauru, which we're going to try and do using HL7 FHIR. So it's a very relevant conversation. I'm happy to chat more about it later. But that is probably butting up against time, and I'm conscious of everyone's probably starting their day over there and finishing their day over here.
Yeah, we are at time. Michael, oh, by the way, we'll have a repository for the session materials. And Michael, if you have anything else you'd like to share, we could certainly post it. But we thank you so much for joining us today. We really appreciate this. I know this is an unusual time for you to be working full on. And so we appreciate you taking the time, and we appreciate the demonstrations and the country experience conversations. Thank you to everyone who participated today. You can watch your email. You'll have a 2-minute survey to tell us what you thought of the session and more announcements. So if you have a comment about Shiriki, you can email us at shiriki@cdc.gov. And I thank everyone again for being here, and have a great day.
Thanks, everyone.